for 22 years. He's located in San Antonio, Texas. Today he is doing a tummy tuck and a removal and replacement of implants, as well as some liposuction. If you guys have any questions, feel free to ask in the comments below, and we'll gladly do our best to answer those for you. We are also live on our YouTube channel right now, so if you're interested in checking that out, you can go to the YouTube link in our bio. And if you're interested in scheduling a consultation with Dr. Barlow, you can do so by filling out this Get a Quote form. When you fill out that form, someone from our team will be in contact with you today to help schedule that consultation and also discuss financing options with you as well. Did she have saline implants before? Oh, okay. They almost look like saline because of how small they are. But I see the mentor symbol at the bottom now. Welcome everyone. Thank you for joining us. While you're here in the live, don't forget to like, follow, and share this live as well. All of that really helps us out, and we're also really close to hitting 20K followers here on Dr. Barlow's TikTok. Tammy, thank you for following. Good morning, Linda. Good morning, Melanie. Thank you for joining us over on our YouTube. If you guys are interested in seeing the full procedure that's being performed this morning, you can do so by heading on over to our YouTube channel. That link is going to be in the bio. Michaela, thank you for following. If you guys have any questions, feel free to ask in the comments below, and we'll gladly do our best to answer those for you. Maya, thank you for following. Good morning, Connie. Thank you for joining us. So Dr. Barlow has already removed the smaller implant, and he will be putting in a new implant, which will be a little bit larger. Yeah, so he's opening up the pocket that the implant will go in. You're going under the muscle for this one still? So from the angle we're at, you should be able to see him actually putting in the implant. He's already replaced the implant in the farthest breast where Jetsi is, who is our surgical tech helping out today. So the gel and silicone are the same. What the difference is between the silicone and the saline implants. So the silicone, if it were to be damaged or rupture, it won't leak into your body. It'll stay within the capsule that it's in. So it's much safer for you, unlike the saline, where if it were to rupture, that saline will drain and you'll kind of go flat in that chest. Now, if you're thinking gel, you could be thinking of the gummy bear implant, which is still a silicone implant, but that's a nickname for it. Kat, thank you for gifting the heart. So you can see where Dr. Barlow is about to use the to insert the implant. You'll kind of see it, she all of a sudden goes from flat to nice and round. Kat, thank you for gifting the tiny dinosaur. That's super cute. I love it. So there's a lot of people that ask if they have to change their implant every 10 years. Something that I've noticed that a lot of our doctors will say consistently is that if it's not bothering you, you still like the look, don't mess with it. There's no reason to mess with it. But if for some reason it starts bothering you or you're not happy with how it looks anymore, then that's when you would need to come in and discuss having a procedure done with the surgeon. Kat, did I see the llama? No, I didn't. Maybe I missed it. Oh, now I see it. Oh, it's so cute! That was so cute! A little llama came up on the screen with a rose in its mouth and like a gold chain around its neck. So like the reason why this patient is having her old implants removed and replaced with new ones was for a size difference. She went from a smaller implant to a larger implant. Kat, you work in an OR as well? Oh, that's cool. Do you work with like plastic surgeons in an OR or do you work with like general surgeons? Bless you. Welcome everyone. If you're just joining us, we're here in San Antonio, Texas with Dr. Barlow. He's a board certified plastic surgeon and has been practicing for 20 years. This morning he is doing a tummy tuck, a removal and replacement of some breast implants, and also liposuction. If you guys have any questions, feel free to ask in the comments below and we'll gladly do our best to answer those for you. Yours are 475cc, the gel silicone. I would say that's pretty common. I've noticed a lot of patients that come and usually get anywhere between like 330, 350, all the way up to like 450, 475. I haven't really seen much in the 500s, but I definitely haven't seen anything over 500. Stella, thank you for following. Linda, I'm glad that you love your implants. It's a good thing to hear for sure. So there's no reason you would need to feel like you would have to come in and get them changed in 10 years.
It used to be a warranty for only 10 years. So
yeah. Is the warranty like lifetime now?
Lifetime replacement.
Nice. And then the main brand of implants that we use here is Mentor. We're one of the #1 sellers for Mentor in states like Texas, Alaska, Oklahoma. And there's a couple other ones, but those are the 3 that I remember at the moment. Oh, I see, Linda. Well, good luck with that. I know it'll be a long healing process for sure. Tammy, so our doctors here do perform breast reductions. So Tammy, if you're interested, or I don't know how old your daughter is, but if she's 18 or older and you think she'd be interested in receiving a reduction, in the description of the channel, there should be a link tree, and in there you can fill out the VIP Express form if you're watching on YouTube. You're very welcome, Tammy. Yeah, Linda, Mentor is definitely, I would say, probably like the most popular brand across the board. Does he do Fs? What do you mean by Fs? I can ask. Give me 1 second. I know a couple of our doctors here will do top surgery. But that's all I'm aware of. City Girl, thank you for following. Sophia, thank you for following. Dr. Barlow, have you ever done female facial feminization? Like making a more masculine face look more feminine? Okay. I know. Yeah. So that's not something Dr. Barlow would do, because he's talking that he's never done it before. He hasn't been trained to do it. And I don't think any of our other doctors have done it. I just know that some of our doctors will do the top surgeries. Crazy Dude, thank you for joining us. If you're just tuning in, we're here with Dr. Barlow. He is a board-certified plastic surgeon in San Antonio, Texas, and he has been practicing for 20 years. Today he is doing a tummy tuck, a removal and replacement of some breast implants, as well as some liposuction. If you guys have any questions, feel free to leave those in the comments below, and we'll gladly do our best to answer them for you. If you're interested in scheduling a consultation, you can do so by filling out this Get a Quote form. When you fill out that form, someone from our team will be in contact with you today to help schedule that consultation and also discuss financing options with you as well. We're also live on our YouTube channel, so if you're interested in seeing the full procedure that's being performed this morning, you can click on the YouTube link in our bio. Lori, thank you for sharing the live. And while you're here in the TikTok live, don't forget to give Dr. Barlow a follow and also like and share the live as well. All of that really helps us out, and we are super close to being at 20K followers for Dr. Barlow's TikTok. I believe we can reach that goal before the end of the week. Thank you for following, boy. Let's see. We are at exactly, oh, we're so close. We're at 19,924. We're very close. Yep. I think we'll hit it by Friday. We'll hit it by Friday, no problem. Did you infiltrate before you started her breasts? You're just copying it? Yeah. Jeff, if she said yes to YouTube when she got her surgery with us, most of these lives are posted directly after we end them. So they should be labeled with whatever surgery it was and who the doctor was on our YouTube channel. Okay, Jeff, I can check. Sometimes some of them don't upload. I can't check right now since I'm live, but I can check later. Are there certain spots they have to be careful from? Linda, do you mean like with the lipo? I mean, in general, yes, there are areas where they need to be careful. But I mean, I couldn't tell you the specific areas of the body they have to be careful around, but they're trained to obviously avoid those areas. Like finding that good balance between enough pressure pushing it in, but being gentle at the same time, because it's definitely an arm workout. I've never done it, obviously, but just from watching it almost on a daily basis, crazy arm workout and shoulder workout. And you can kind of see, like, depending on where Dr. Barlow is with the lipo, he's feeling with his hand as well. Maria, thank you for following. And that's, you know, if you were awake, it would 100% be painful. That is why it's always nice to be asleep. People always ask, can I get lipo under local anesthesia? And I'm like, no, you wouldn't want it under local. You want to be asleep.
It's technically possible.
It is technically possible, but you'll be a lot more comfortable if you're asleep. Now, there are some revisions that can be done under local. Like, for example, this morning, Dr. Barlow had a revision on a tummy tuck scar. And that only lasted about 30 minutes. Sometimes they'll do revisions on breast augmentations under local, but once again, they're not taking very long. So if the procedure's not going to take a super long time, and it's mainly a revision, they'll do it under local. But otherwise, it's always general anesthesia. And our anesthesiologists that we work with are also board certified, just like our plastic surgeons. So just a good thing to know when you're coming in and having surgery with us or any doctor. It's nice to know that they are board certified in what they do. And of course, double check your research on your doctors as well. And that's across the board for any kind of doctor. Welcome everyone. If you're just tuning in, we are here with Dr. Barlow in San Antonio, Texas. He's a board certified plastic surgeon and has been practicing for 20 years. Today he is doing some lipo as well as a tummy tuck and as well as a removal and replacement of some breast implants. If you guys have any questions, feel free to ask in the comments below. So like what Dr. Barlow is doing now, he's using the vaser, which is another heated tool that helps kind of melt the fat a little bit so it's easier to suck out. So it's not as tough on their shoulders with the liposuction. It's still tough, but much easier with the vaser for sure. If you're interested in scheduling a consultation with Dr. Barlow, you can do so by filling out this Get a Quote form. When you fill out that form, someone from our team will be in contact with you today to help schedule your consultation and also discuss financing options with you as well. Caitlin, thank you for following. We're also live on our YouTube channel, so if you're interested in seeing the full procedure today, you can head on over to our YouTube channel, and that link is going to be in the bio. Linda, your friend wants like the lipo, like lipo 360. Because if that's what she wants done, I highly recommend that she adds the vaser with her lipo. It's usually not something that's included with the lipo. It's usually always an add-on. Yeah, and then we have the Renuvion. Renuvion is a, oh my god, we literally talked about it earlier, helium and radio frequency tool that's heated, and it helps contract the fibers under the skin that are left over from where the fat was sitting and makes the skin kind of shrink up and tighten a little bit. So it's good if you don't have like extreme excess skin, like if you just got a little bit of loose skin, that'll help tighten up that skin very nicely. Linda, so when we're on YouTube, I show the doctor and who they're operating on, so patients can see the full procedure. If you want to see my face, I'm over on TikTok, because I can't show the full procedure on TikTok. Pepper, thank you for following. Oh yes, Linda. Dr. Barlow is really, really good at what he does. Most often he does work with extreme weight loss patients. So removing a lot of that excess skin, doing tummy tucks, arm lifts, medial thigh lifts, axilloplasties. Lynn, long time no see with a whole bunch of stars. Thank you for joining us this morning, Lynn, while it's still somewhat morning. We're almost into the afternoon. Robin, thank you for following and also liking the video. Robin, you don't want me doing surgery? I am just a social media person. I can't English today. Dr. Barlow is the one doing the procedure today. He's a board certified plastic surgeon and has been practicing for the last 20 years. Fun fact about Dr. Rocket, Dr. Barlow, the reason why he has his nickname Dr. Rocket is because he used to be a, what kind of engineer? Aerospace engineer. So he worked with NASA.
We like to say rocket scientist.
Yes, rocket scientist. So that's where he gets his nickname from. So that's what he used to do before he started practicing in plastic surgery.
Never say, what are you, a rocket scientist? You say yes.
Yeah, because all he can say is, well, yeah.
That's the thing. When I was in NASA, it was always, it's not brain surgery. When I went to do neurosurgery, like, it's not rocket science. Like,
Jennifer, thank you for following. Jennifer, also thank you for liking the live as well. We appreciate your support. If you guys have any questions about plastic surgery, feel free to ask in the comments below and we'll gladly do our best to answer those for you. We're here today with Dr. Barlow. He is a board certified plastic surgeon here in San Antonio, Texas, and has been practicing for the last 20 years. Today he is doing a tummy tuck, a removal and replacement of breast implants, as well as some liposuction. And once again, guys, if you do have any questions, feel free to ask in the comments below. If you're interested in scheduling a consultation with Dr. Barlow, you can do so by filling out this Get a Quote form, and we'll have someone from our team be in contact with you today to help schedule that consultation and also discuss financing options with you as well. User 3512, thank you for following. I think sometimes on TikTok you can join the lives anonymously. So that's what the users with a whole bunch of numbers are. It's just an anonymous person. Can you kind of see the tummy tuck? Okay. Jay, thank you for gifting the heart. fibroid tumors? Do you have to have surgery? Are you concerned that they'll interfere if you want to get some sort of cosmetic surgery? Jay, thank you for gifting the team bracelet as well. Kimmy, so I can't show Dr. Barlow on TikTok because I can't show the full procedure. So yes, he does look very different from his profile picture at this current moment during the live. Because it's me. Oh, I know it's a joke. I know it's a joke. Dee, thank you for following. If you want to see Dr. Barlow's face, though, we are live on YouTube, and you can see the full procedure over there, and that link is in the bio. Yeah, you're not even wearing your glasses in your profile picture either. True. Oh, I saw that. Same with like the runners and stuff, where they have like their partner that runs with them to help guide them. I unfortunately pretty much live in my glasses. I can't really do anything without them. Welcome everyone. If you're just tuning in, thank you for joining us this morning. We are here with Dr. Barlow in San Antonio, Texas. He is doing a tummy tuck as well as a removal and replacement of breast implants and some liposuction. If you guys have any questions, feel free to ask in the comments below. A lot of people say that when they see the full procedure over on YouTube, they're like, oh, it looks painful, but the patient is under general anesthesia. So they're not gonna feel anything. They also inject Exparel as well to the area, which is a localized pain relief that will last 3 days after your surgery. So that is a big help as well. Mama, thank you for liking the live. Or Mama, I think that's right. Christina, can't wait to meet Dr. Rocket and have my surgery. Christina, do you already have your surgery booked, or are you still looking to schedule it? Okay, Christina. If you haven't scheduled your consultation yet, I recommend filling out this get a quote form, and someone from our team will be in contact with you today to help schedule your consultation so you can start that process of scheduling your surgery. Especially if you want to be seen over the holiday season, so like November, December, early January. We're already booking up pretty quickly for those months because that is our most busiest time of year for procedures. So if you want to get in this year during that time, you gotta set it up now. Start the process now. Otherwise, you might not get in. Sandra, thank you for following. Sandra, yes, we are located in San Antonio, Texas. Kelly, thank you for following. Melinda, thank you for following. Kelly. Dr. Barlow had 2 surgeries today. One was a local, so it was just a quick revision for a tummy tuck scar. And then right now he is doing his second case, which is a tummy tuck, removal and replacement of breast implants, and some lipo. We have 5 total of board-certified plastic surgeons working at this practice. So we have Dr. Barlow, Dr. Phillips, Dr. Cornejo, Dr. Cuvion, and then we also have Dr. Jeneby. Empty Nest Nana Hustle, yes, there is a charge for the consultation. We offer virtual and in person. I'm not entirely sure what the prices are for those, but when you do pay for the consultation, what you pay does go towards your surgery. So I'll go ahead and pin this get a quote form if you're interested in scheduling that consultation, and we'll have someone from our team give you a call today to help set up that consultation and also discuss financing options that we have available for our surgeries. you see what he's doing right now?
On the other one, or you speaking?
No, I can see from here. Yep. So he's doing the muscle repair right now for the tummy tuck. Welcome everyone. If you're just tuning in, thank you for joining us. We're here in San Antonio, Texas with Dr. Barlow. He is a board certified plastic surgeon. Today he is doing a tummy tuck as well as a breast removal and replacement with implants, and then also some lipo. Nana, if it's the question about the charge for the consultation, I did see it. I'm sorry if you missed my answer, but there is a charge for the consultation. You can do it virtual or in person. But whatever you pay for your consultation does go towards your procedure, and those consultation prices can vary a little bit just because each one of the doctors have a little bit of a price difference due to their time of experience. So if you're interested in scheduling a consultation with Dr. Barlow, go go ahead and fill out that get a quote form, and we'll have someone from our team be in contact with you today to help schedule that consultation and discuss financing options as well. Welcome everyone. If you're just tuning in, thank you for joining us. We're here in San Antonio, Texas with Dr. Barlow. He is a board certified plastic surgeon and has been practicing for 20 years. Today he is doing a tummy tuck as well as a removal and replacement of breast implants and some lipo. If you guys have any questions, feel free to leave those in the comments below. And if you're interested in scheduling a consultation with Dr. Barlow, you can do so by filling out this get a quote form. When you fill out that form, someone from our team will be in contact with you today to help schedule your consultation and also discuss financing options with you as well. And while you're here, don't forget to give Dr. Barlow a follow and also like and share this live. We're super close to hitting 20K followers on Dr. Barlow's TikTok. So we would really appreciate some follows today. I believe we can meet that goal of 20K by Friday. We just need y'all's help. Melina, thank you for following. Christina, thank you for following. The group chat.
Okay.
Yeah, for me. The lion.
Oh.
And then just say he TikTok DM. Perfect. Thank you. Be strong in the Lord. Never give up hope. Gonna do great things. I already know. And then there's another one. The reply.
Do you want me to respond to it?
Yes, please.
On he, right?
Yes. Linda, so Dr. Barlow is doing the muscle repair right now, which is a part of the tummy tuck. Nana, you can see Dr. Barlow's before and afters on his Instagram. His username is also going to be Dr. Rocket, no capital, no period, and Rocket is with 2 T's. they send their information.
Oh, okay.
Yeah, only when they send their information. Yeah, because otherwise they can't really contact them.
Yeah.
So, I mean, the team has access to the DMs, but it's just easier for us to only send it once they send like a phone number or an email. So. Thank you for gifting a rose. Pam, so you can see the full procedure over on our YouTube channel, and link for YouTube is going to be in the bio. Katie, you love the background music. I do as well. I really like listening to this music while we're in the OR. So thank you for the compliment. It is Dr. Barlow's choosing. I will say this particular station I probably sing along with the most compared to other stations that some of the other doctors listen to. I don't know why. I mean, I know a lot of the songs on this station, but in general, I have more of like I have a harder time restraining myself from singing along with this station. Positive vibes. Thank you for following. Welcome everyone. If you're just tuning in, thank you for joining us today. We are here with Dr. Barlow. He's a board certified plastic surgeon in San Antonio, Texas, and has been practicing for the last 20 years. Today he is doing a tummy tuck as well as a removal and replacement of breast implants and lipo. If you guys have any questions, feel free to leave those in the comments below.
All right, so this.
Tina, thank you for following. Katie, thank you for following. Bailey, thank you for following. Bailey, also thank you for liking the live. did you have a question? I didn't see it earlier. Sometimes TikTok does filter out comments that you guys leave and I can't see them. And usually it's because of maybe a certain word that you used, which causes TikTok to filter it out. So you might have to rephrase your question if I haven't seen it. I promise I'm not trying to ignore anyone. Sometimes I just can't see the question. Linda, thank you for singing with me. I appreciate it, even though I can't hear you because you're on the other side of the screen. I appreciate you joining in with me. Vivian, that's not something we discuss when we're on live. I know your question is probably harmless, but it's something that we choose not to discuss. Patricia, I'm not doing any of the operation, so hence why I'm not wearing gloves. And even if I was wearing any kind of glove, they would have, if, you know, there are gloves in here, but there's non-sterile gloves and there's sterile gloves. There's still a difference. Honeyboo, we are located in San Antonio, Texas. Welcome everyone. If you're just tuning in, we're here with Dr. Barlow. He is coming to an end here shortly with finishing up on a tummy tuck. And for this patient as well, she has gotten some lipo and a removal and replacement of some breast implants. If you guys have any questions, feel free to ask in the comments below. So then usually depending on how the lights are doing, I'll either leave once they fully remove both sides. But if the lights are doing well, I'll usually stay until they bring through the belly button, because they have to create that new hole. Otherwise, after that, It's just suturing.
Usually what she'll do is surgical consent.
Yeah. Well, Barlow will usually stay and do the whole thing. Jeneby will stay for most of it, but then the surgical side will finish up the suturing for the most part. Nikki, we are in here as long as the patient consents. We always ask before they come in as a part of their paperwork. If they didn't fill out the consent form for me to be in here for doing the lives, I wouldn't be in here. You're welcome, Nikki. Nikki, thank you for sharing the live. Alrighty guys, so mainly at this point it's a lot of just stitching. Dr. Barlow still has to create the area where the belly button will come through for the tummy tuck. But I'm going to give you guys a couple more minutes to ask any last minute questions you may have. Fill out that get a quote form if you're interested in scheduling a consultation with him. So feel free to ask, fill out that form, give us a follow.
Together, fine.
I can ask what kind of stitching it is. Dr. Barlow, is there a certain name for the kind of stitch that you're doing right now?
The superficial fashion, a really strong layer deeper in the skin.
Because you guys you do like the suturing underneath and then you do like the stitching in layers.
Yeah, this is the first layer. So this is a very, it's running normal with the barb suture.
Mhm.
By running something different. One of those is up and down, one of those is horizontal and skin surface.
So this one is not the barbed one. No? Okay.
You can last longer and it's deeper, so you can last longer. Takes tension off the skin, surface part of the skin. Go with a thinner scar later.
And the stitching in like what you consider the layers, it helps relieve like that tension on the area.
Yeah, all I did is put like some big stitch, just staples in the surface part. Maybe, hopefully, maybe not.
Yeah.
But then it was in a spread over time because for deeper tissue is more supportive of the skin edge.
Okay.
So it has to get wider, kind of sink in the foam. By doing these deeper layers, it's stuff that's put together all the way down. There's no real space. It's like a virtual, what we call dead space underneath. Just because the skin was separate, the drains can help suck that down.
Okay.
So what about this is just to put fluid and baby cake and later cut it. Scarlet.
Darby, thank you for following. Alrighty guys, I'm going to give you another 30 seconds to ask any kind of last minute questions, fill out that get a quote form, and then we will see you guys again tomorrow, because I believe Dr. Barlow is operating again tomorrow as well, and 2 of our other doctors will be operating. Kim, thank you for following. Alrighty guys, thank you so much for joining us today, and we will see you all again tomorrow back in the OR. Have a good rest of your day, guys. Alrighty.